Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team at Inovalon, and joining me today is Jennifer Terrell, the Chief Medical Officer at Post-Acute Analytics. And today we're going to talk about the post-acute care journey and advancements being made in the space. Thanks for being here today, Jennifer.
Thanks, Justine. Excited to be here.
Great. So before we get started, tell me a little bit about yourself and your role in post-acute analytics.
Thanks, Justine. I am the CMO here at Post-Acute Analytics. I am an emergency physician and have worked in post-acute care or with other vulnerable populations since about 2014, actually, before landing here. I have worked with other care management organizations and utilization management organizations in the past. And what really excites me about PAA is that we are able to accelerate SNF authorization requests with rapid approvals, as well as provide transparency to payers or hospital systems to help them follow their patients once they've entered into the post-acute space and support safer, more expedited care transitions. So it's a pretty exciting space to be in here at PAA.
And, talking about what you guys do, a lot of that is that relationship between the payer and the provider. So we know sometimes there can be a little friction there. Tell me a little bit about what that looks like, and then when it occurs, what are some of those downstream effects?
Right. I think the payer-provider friction has been in place as long as there have been payers in the provider space. Three of the big standout friction points that I see most often would be, number one, administratively burdensome processes. A lot of paperwork is required. There are very manual processes to obtain authorizations when it comes to any type of inpatient request. If it's in the acute care hospital, if it's in the post-acute setting, really they can be very complex, and it can be a prolonged process to obtain those authorizations. That can lead to delayed approvals for these levels of care because of the human intervention that's required. And I would say, lastly, the lack of clear expectations between the provider and the payer can be very difficult to overcome. I talk to many providers who are really frustrated. They don't feel that they understand what's required of them to have an approved request for a particular level of post-acute care. And I'll tell you, the payers are equally frustrated by lack of documentation submitted to support approvals as quickly as possible for a level of post-acute care or really any other inpatient setting. So it frustrates all sides. And at PAA, what we focus on is getting these barriers reduced as much as possible. We can use artificial intelligence to read medical documentation and pull out the essential elements that are required by the payer, and then share with the providers why a post-acute care level is appropriate or perhaps not for a particular patient. So it can really smooth out each of those pain points rather smoothly by integrating into the electronic medical records.
And, that's perfect lead into my next question of how technology plays in here. And we have seen technology, the use of data in healthcare has been evolving rapidly over the years. And you've kind of hit on this, but how have you seen technology help with some of those challenges? And, what are the kind of advancements that you're seeing in the space?
Yes, the integration into the electronic medical records is really the linchpin that reduces the human touch. There aren't phone calls and faxes required between whether it's the payer or a delegated health system, such as an ACO, hospital system, et cetera, and the post-acute setting. It can be really burdensome on a nurse who just wants to take care of her patients to fax documentation that she printed out of the EMR, then she put it on a fax machine, and then she called to make sure it was received, et cetera. We can smooth that out via integrations and the ability to unlock unstructured data and gain insights from what is maybe dictated into an EMR or typed freehand. We can really pull the elements out now that we have such advanced AI capabilities to understand human conversations.
And we know AI, that has been a topic that, you can't have a conversation around healthcare where AI doesn't come up. So when we say looking forward, we know AI is a part of that. But anything else that you're really excited about as far as further advancements in the industry?
I think it's going to really build upon the AI advancements that we're having. But I do think we'll see changes that are perhaps less anticipated by leveraging predictive analytics after having these large data sets that are, well, for instance, the company Ambient can listen to the conversation between a physician and a patient and extract the main points of the conversation, document those, get them into the electronic medical record, and make this data actionable in the future, as opposed to a conversation that quick notes are taken after the fact. Having this robust source of data that was really inaccessible previous to the AI revolution, really, if you will help, I think, create predictive analytics that may obviate the need for a post-acute care stay or even an acute care stay if we can really center ourselves around patient-centric analytics and understanding how to predict outcomes prior to acute events or much earlier in a patient's course of their illness, if they even develop an illness.
And I'm so glad you hit on that kind of outcome piece. And we talk about it so much at Inovalon. Is everything that we're doing is, we talk data, technology, but it's all, there's a person at the end of it. There are patients and real outcomes that all of this is impacting. So really great to hear you say that. And just want to ask one final question before we wrap up. Not only as an executive leader in healthcare technology, but also as a physician, I'd love to know, do you have an example of a time where you saw firsthand how these technology advancements were directly influencing a clinical outcome?
Yeah, I think we have a case study that I'm happy to share with you in our work with Providence Health System. And I still think at a more population-based level today, but I will break this down to an individual level as well. In using our INO software platform to communicate between their care navigators that work for the ACO and other value-based, the hospital system, and they keep track of not only ACO patients but other value-based patients throughout their patient population and census. They were able to reduce the recovery time of their patients by 10%, which that's your mother, your grandmother, their home, even if it's only 10%, that could be a day or 2 days out of a 20-day potential stay in a skilled nursing facility. Those are days at home with their family and their loved ones. They were also able to have the third lowest readmission risk for any MSSP, the 30 largest MSSPs in the country, which was a really, I think, an outstanding accomplishment for them, and we're just very proud that we could be part of it. But when I think about, my grandmother, when she had a hip fracture, I would love to have had her home 2 days sooner and definitely not see a readmission. So I think all of these pieces together are very promising for patients at the end of this hospital journey. And even just in the last 2 years, I would say I would have loved to have had this 2 years sooner and think about care management and how we can get ahead of disease processes that we know are chronic and will continue into the future. And perhaps we can head those off sooner and we have fewer hip fractures to send to skilled nursing facilities altogether.
That is awesome. I love it. And again, hearing that all of this work that companies like PAA and Inovalon are doing and seeing the impact it's making is awesome. So, Jennifer, it was really great talking with you today. Appreciate your time and insights. And as always, to our audience, thanks for joining, and be sure to tune in again next time.
Thank you.